Hello, how are you today?
Good, how are you?
My name is Olivia Martinez. I'm a nursing student from Dominican University, and I'll be doing your head-to-toe examination today. Okay, so I've introduced myself, and I have also done hand hygiene. I'm gonna put my gloves on next. Okay, so the first part of this assessment is going to begin with an examination of general appearance. So I have assessed her overall appearance. She seems to be dressed appropriately for the weather. I'm also assessing hygiene status and nutritional status. So she seems clean and like she tried when she got dressed today, and she also has her makeup done, as well as her nutritional status is an assessment by just appearance of weight, and it looks fine. So the next thing I'm going to do is assess level of consciousness by asking 3 questions. Can you tell me your first and last name?
Marilyn Nunez,
Okay. Do you know where we are today?
Dominican University,
And do you know today's date?
Thursday, January 4th, 2018.
Yes, that's all correct. So she got all 3 questions right. So that would mean that she is alert and oriented times 3 to person, place, and time. And then after that is the first part of the cognition and memory assessment. So I'm going to give you 3 words to remember, and then in 10 to 20 minutes I'm going to ask you to repeat them back to me, okay? So it is book, house, and car. Okay? So then we're going to move on and go ahead and do an assessment of the mood. So that's based off of our interaction so far. I'm going to be assessing affect, appropriateness, and attentiveness. So her affect has been appropriate. She's been attentive to our conversation, and her answers have been appropriate with any other questions I have asked. So then after that, I'm going to be assessing for pain. Are you in any pain today, Marilyn?
No.
No. Okay. So if the patient were in pain, then I would use the mnemonic old cards to assess her pain. That stands for onset, location, duration, characteristics, aggravating factors, alleviating factors, radiation of the pain, timing, and severity. And also to assess severity, I would ask her to rate her pain on a scale of 0 to 10. 0 being no pain to 10 being the worst. And then again, I would ask for characteristics of the pain. And the following assessment I would do would be of her posture, positioning, and mobility. So I have assessed her posture while she's been sitting here. So she sits erect. She's not slumped over. She seems comfortable when relaxed, and also I don't see any assistive devices. So then we're going to move on to the HEAT examination. So the first thing I'm going to do is inspect and palpate her head and hair. So I'm looking at her scalp and hair for any abnormalities as well as quality. So nothing seems to be abnormal, and her hair seems healthy. After that, I'm going to do a general inspection of her face, and I am looking to see her facial features, and I'm looking at her eyes, nose, mouth, and tongue, and I'm inspecting to see if everything is symmetrical, which it is. After that, I'm going to do my first examination of her eyes. So I'm just looking at them. I'm looking at the lids, sclera, and conjunctiva. I'm going to pull your lids down so I can see. Okay, so there was no redness, exudate, or ptosis. And after that, I am going to assess perla. Okay, so I'm going to ask you to look straight ahead, and then I'm going to shine a light and look at her pupils. Okay, her pupils were equal, round, and reactive to light and accommodation. So after that, we're going to move on to the assessment of cranial nerve 2, which is the optic nerve. So I'm going to have you step down and stand 10 feet away from the Snellen chart and cover your left eye first. And then go ahead and read me the smallest line you can.
So I can read line 8, DEFPOTEC.
Okay.
And then the other I, DEFPOTEC.
Okay, that would be indicative of both eyesights of 20/20. So that would mean that that cranial nerve is intact. You can go ahead and sit down again. Excuse me. So after that, you would then assess cranial nerves 3, 4, and 6. That would be oculomotor, trochlear, and abducens. So I'm going to assess that using the 6 cardinal fields gaze test. So I'm going to have you look, keep your head straight, and then I want you to your eyes to follow my finger. Okay? Okay, so she was able to do that, so that would mean that all 3 cranial nerves are intact. After that, we're going to assess cranial nerve 7, which are facial nerves. So I'm going to have you raise your eyebrows and then smile, show some teeth, puff out your cheeks, blow through pursed lips, and then I'm going to have you close your eyes, and I'm going to try and open them. Don't let me. Okay, that's perfect. Also at this point, I would do the taste test, which I would give her different samples of something that is either bitter, sour, sweet, or salty, and if she can correctly identify them, then that cranial nerve would be intact. The following nerve we're going to assess is cranial nerve 5, the trigeminal nerve. So for this nerve, I'm going to ask you to bite down. Well, if you feel your temporal muscle, okay, bite down one more time. I felt your masseter muscle, and then I'm going to ask you to move your jaw from side to side. Okay. So I've assessed that she was able to move her mandible, and the following test I'm going to do is the sharp or dull test. So I'm going to have you close your eyes, and then I'm either going to touch you with an object that is dull or sharp, and I want you to correctly identify it, okay?
Sharp. Sharp. And soft. And soft.
So she was able to correctly identify those on her forehead, cheek, and jaw, as well as being able to move her mandible from side to side, so that means that that cranial nerve is intact. So the following nerve we're going to assess is cranial nerve 1, the olfactory nerve. So for this, again, I'm going to have you smell 2 different scents and have you correctly identify them. So the first scent, I'm going to have you plug one of your nostrils. Okay, and then what does this smell like to you?
Mint.
Correct. And then you can unplug that one and plug the other one. What does that smell like to you?
Watermelon.
That is correct. So that cranial nerve is intact. The following nerve we're going to assess is cranial nerve 9 and 10, which is glossopharyngeal and the vagus nerve. So for this, I'm going to need a tongue depressor. And my tongue. Okay, can I have you stick your tongue out and say ah? Okay. So for that, I was looking to see that her soft palate moves and that her uvula stays at midline. I also assessed her pharynx, buccal membranes, gums, and teeth. So I noted that her pharynx is glistening, pink, moist, free of lesions. Her tonsils sit behind the posterior pillar. There's no exudate on them. They're not inflamed. She has all her teeth and all her buccal membranes are also pink and moist. So the following nerve we're going to assess then is cranial nerve 12, which is the hypoglossal. So I'm going to ask you to stick your tongue out and move it from side to side. And then repeat after me. Light, tight, dynamite.
Light, tight, dynamite.
Okay. So as she stuck her tongue out and moved it side to side, I was able to note that her tongue was glistening, pink, moist, free of lesions, and she was able to enunciate the words correctly, so that cranial nerve is intact. The following cranial nerve we're going to assess is cranial nerve 11, which are spinal accessory. So for that, I'm going to test the strength of her neck and shoulders. So I'm going to ask you to move your head against my resistance. Okay? And then lift your shoulders. Okay, perfect. So her strength was 5 out of 5 for her neck and her shoulders. Now, the following thing I'm going to do is palpate her lymph nodes. So I'm going to start by palpating the pre-auricular, post-auricular, occipital, submandibular, anterior cervical, posterior cervical, and the supraclavicular. So on palpation, I want to feel that they are non-firm, tender, or enlarged. If they were, that would indicate infection. If they were asymmetrical, hard, fixed, and tender or non-tender, that would indicate a malignancy. So that concludes that part of that examination. Then we are going to move on to peripheral vasculature. Okay, so the first thing I would assess would be the carotid arteries. And I would assess them one at a time. Because if I'm assessing them at the same time, the patient could pass out. So the following thing I'm going to do is auscultate them using the bell of my stethoscope. I'm going to ask you to hold your breath while I listen. Okay. I am listening for bruits, which there are none present. And then the next thing I'm going to do is assess for other pulses. And normally these would be worked into the head to toe examination as we go down. But I would assess the brachials first. And I am feeling to make sure that they are equal bilaterally and +2, which they are. And then I would do radial. Again, they're equal bilaterally and +2. The popliteal, equal bilaterally +2. The posterior tibial, equal bilaterally +2. And the dorsalis pedis. Which are equal bilateral and +2. So the next part of the examination would be the integumentary. So I'm assessing her overall, so at this point I've assessed her overall appearance, and I can say that her skin and pigmentation color is appropriate to her race and ethnicity. So after that, I would assess the temperature of her skin, and I would do that by taking the dorsal part of my hands and feeling hers. I'm checking to see that that her skin is warm, smooth, and dry, and also her texture. I would also note if there were any abnormalities like excess heat, cold, or diaphoresis, which there isn't. So the following thing I'm going to assess is skin turgor. So I would do that using the back of her hand, and I'm just going to pinch it. If the skin were to be tented and didn't return back quickly, that could indicate signs of dehydration. Then I would do another general assessment of her integumentary or skin, and I would be looking for abnormalities such as jaundice, pallor, erythema, cyanosis, lesions, tattoos, piercings, or rashes, which none are present. So then the following thing I would do is assess capillary refill and look for clubbing of the fingers. So I'm looking to see that there is return to color less than 3 seconds. If it took longer than 3 seconds, then it would indicate poor oxygenation, as well as if there was clubbing present. which everything is fine and checks out. So we can go ahead and put her socks back on. Okay, and after that, I would then move on to the part of the examination, the cardiac and respiratory. The first thing I'm gonna do is I'm gonna just inspect her and look at her for a minute so I can get her respiratory rate, as well as I'm looking for even rising of her chest, use of accessory muscles, flaring. Okay, so she has even chest rising, had a normal respiratory rate that fell in between 12 to 20. Her respiratory rate was 16, so it was normal, and there was no nasal flaring. So then after that, I would then auscultate her lungs, and I'm listening to 8 spots anterior, 10 posterior, and 7 lateral. Okay, I'm gonna have you take a deep breath every time I move my stethoscope, okay? Okay. Okay, so everything sounded normal, her lung sounds were clear, and now I'm going to identify the markers I was using to move my stethoscope. So the first one is the medial sternal line, then the suprasternal notch, the clavicles, and then if you feel, you can feel ribs, and right underneath it would be intercostal spaces, and then the location of the coastal ankle. So then after that, I would then listen to the hard sounds, starting with the apex. Now I'm going to listen for a full minute to get her heart rate, as well as note rhythm of the heart. Okay, so her heart rate was normal. It was in between 60 to 100. Her heart rate was 74, and I noticed that S1 and S2 were present, and she had a regular rhythm. So after that, I will now auscultate different parts of the heart on her chest. The first location I'm going to be listening to is at the aortic valve, which is R2 ICS. And then I'm going to move on to the pulmonic, which is L2 ICS. And then I'm going to listen at Erb's point, which is L3 ICS. And then I'm going to listen at the tricuspid, which is L4 ICS. And then I'm going to listen at the mitral, which is L5 ICS, at the midclavicular line. Okay. Then after that, we can move on to the abdomen. So I'm going to ask you to lie down, and I'm going to uncover your abdomen. So the first thing I'm going to do is just inspect it. Again, I am looking to make sure that the pigmentation is appropriate to race and ethnicity, for any lesions or abnormalities, as well as symmetry, and with the umbilicus at midline, which it is. So the next thing I'm gonna do is listen to vowel sounds. So I wanna hear vowel sounds every 5 to 15 seconds. If I don't hear them within that time, I would listen for a full 5 minutes. Okay, as I auscultated, I started at the right lower quadrant and worked my way around. I was also listening to see if I noted any abnormalities, such as hyperactive or hypoactive vowel sounds, which everything was normal. And now the next thing I'm going to do is auscultate at the vascular sounds. And I'm going to use the ball of my stethoscope for this. So the first place I'm going to listen to is the aorta, the abdominal aorta. And then I'm going to listen at the renal arteries, the iliac arteries, and the femoral arteries. And then the epigastric area, or the umbilicus area. Okay, now normally sounds aren't heard in the vascular areas. So if I were to hear something, I might hear a brewery at the aorta, which could indicate an aneurysm, or I could possibly hear a hum in the epigastric or umbilicus area, which could be indicative of pulmonary hypertension or cirrhosis. Okay, so I'm done auscultating. So the next thing I'm going to do is palpate. And again, I'm going to start at the lower right quadrant and work my way around. And then I'm going to ask the patient if they feel any pain with me pressing down.
No.
Or letting go. No. Okay, so then I would, if there was a need for me to do deep palpation, I would palpate 4 to 6 centimeters down, and I would be feeling for organs or masses on organs. Okay, you can go ahead and sit up now. Okay, so after that, we're gonna go ahead and move on to the neuromuscular assessment. So the first thing I'm gonna have you do is stand up. Okay, and I am just looking at her general appearance again and posture. So I'm looking to see that she stands straight and erect, that her spine is at midline, and there's no abdominal curvatures, no abnormal curvatures, sorry. Which is, she seems normal. So the next thing I'm gonna have her do is reach down and touch her toes. And I'm gonna palpate her spine. And again, I'm checking to see that it is straight at midline, no pain, tenderness, or abnormal curvatures, which everything checks out. You can go ahead and stand back up. So then after that, this is the point of the assessment where I am going to finish assessing cognition and memory. Now, do you remember the 3 words I asked you to remember at the beginning of the assessment?
House, car, book.
Yes, so that is correct. So her cognition and memory is intact. So the next thing we're going to do is assess your range of motion and your and strength on your upper extremities. Okay? So I just want you to follow my lead. Okay? So just take your hand and raise it, and then cross it over and touch your back, and then bring your hands around your neck. Okay? So now we're going to do that with the other arm. Okay? So raise it, cross, touch your back, and then cross it your back. Okay, so she seems to have, her range of motion was intact and there were no limitations, so now I'm going to test her strength. So I've already assessed the strength of her shoulders earlier, so I'm just going to assess the one of her hand. So can you push up against my resistance and now down? Okay, and then can you pull your hands back? Okay, and then down? Okay, so her strength was 5 out of 5, again without injury or limitations. Okay, so now we're going to assess range of motion and strength for hips, legs, and feet. Okay, for range of motion of hips and strength, I'm going to have you push your leg up, okay, and then down, and then up, and then down, okay, and then can you push forward with your legs, and then back, and then up, and then down. Okay, also, can I have you lift your leg for me? Okay, and now this one. And then can I have you roll this ankle? And this one. Okay, perfect, thank you. So again, her strength was noted at a 5 out of 5, and then her range of motion is sufficient without injury or limitations. Okay. So the following thing we're gonna assess is your cerebellar function. So there, this is gonna involve 3 tests I want you to do. So I want you to touch each finger to your thumb, increasing in rate. Okay, perfect. The next one we're gonna do is rapid arm movement. So your hands on your lap, and then just flip them back and forth, increasing in rate again. Okay. And then the last thing I'm gonna have you do is stand up for this one. And you're gonna touch your heel and move it up to your shin. Okay, and then your other foot. Okay, perfect. Okay, while you're standing up, now I'm going to do the Romberg test. So I'm gonna have you put your feet together, hands to your side, and close your eyes. Okay, and then I'm just gonna have you stand like that for a few seconds. Okay, so I'm noting to see if there's minimal swaying, which there is. You can go ahead and open your eyes now. So if she were to have swayed too much or taken a step while she had her eyes open or closed, then that would be a positive Romberg test. But you passed. So you can go ahead and sit back down. And then the next thing I'm going to assess is your deep tendon reflexes. Okay? So I'm going to assess the tricep one first. I'm going to have you bend your arm like that. Okay? Okay. And then this one. Okay, so there was minimal movement. The next one I'm going to assess is her bicep. So on this one, I'm not going to be striking her. I'm just going to strike the mallet on my finger, and I'm just going to feel for the muscle. I felt that one. And that one. And then the next one I'm going to do is the brachioradialis. So again, I'm not looking for a reaction. I'm just placing my thumb on her, the middle of her forearm to feel the reaction. Okay, and then I'm going to do the patellar one next. Okay, and then I'm going to have you stand up for this one and to check her Achilles one. Okay, and then your other foot, can we switch foots? Okay, and there was minimal movement on that as well. So after that, you can go ahead and sit down. I'm going to do the Babinski test. I'm going to take your socks off for this one more time. Okay, and I'm just using the back of the mallet. I'm going to make a straight line going across the bottom of her foot. Here we go. And here you go. Okay, so her deep tendon reflexes were +2, which are normal findings. And the Babinski reflex, I am looking to see if there's fanning. If there is fanning, that would be an abnormal finding, which could indicate pyramidal tract disease in adults, but a normal finding in neonates. Also, there's one more we could have assessed, but since her deep tendon reflexes were not hyperactive, which would be a +3 or +4, we did not do it, which would be the ankle clonus. And for that one, I would just have her sit like that. I would take the mallet and I would strike her by her ankle. And again, I am looking to see that there is no movement. If there was a reaction, then that would be a positive test. And that concludes our head to toe examination.